Hi there everybody, my name is Dr. Hasina Kaji, and for those of you who don't know me, I'm an integrative specialist physician and co-founder of the Nutrition Network as well as Eat Better South Africa. I think we're all still reeling from the information that we're getting about coronavirus, the natural history of coronavirus, and the clinical manifestations of this virus globally. What's been very interesting for me is looking at the cases that are worst affected. There's an article that I have here in front of me from a China study, the first large study looking at the effect of underlying illness of the people affected by COVID-19 in China, where they analyzed 1,590 patients. After taking into account the patients' ages and smoking status, researchers found that 399 patients with at least one additional comorbidity, so cardiovascular disease, diabetes, hepatitis B, chronic obstructive pulmonary disease, chronic kidney disease, and cancer, had a 79% greater chance of requiring intensive care or intubation and ventilation, or both. And if you had two or more of these illnesses, that increased your risk, your outcome by 2.5 times the risk of the outcomes that I've mentioned. Why this is so interesting to me is because that is the very reason why we are all so passionate here at the Nutrition Network about education around preventative health, especially the role that nutrition plays in improving health and improving outcomes. I link an article that I wrote for Eat Better South Africa, the information that we're giving people to tips to stay healthy and the foods that can be consumed. But we just wanted to reach out to you during this time. We know that many of you are under quarantine, are at home or self-distancing. That's what our country is doing at the moment and what we've been advised by our president last night. And during this time, many of us would like to bolster our own nutrition information. And I find it very comforting to be armed with education. I think many of you do too. If this is something that you would like to do, we at the Nutrition Network would like to offer during this period a 50% discount on any of our courses that we offer at the Nutrition Network. We're also very aware that many of you may have lost some income or have some financial instability at the moment. We do acknowledge that. If you find yourself in a position where you would like to do any of our courses, gain more information, then please contact us at the link below. We do provide scholarships to our education content and courses. So please, I hope that you will use this this time to educate yourself, to make use of this opportunity to increase your nutrition information, to learn about the foods that you can eat that improve your immune function and your immune system, to learn about the benefit that ketosis has on the immune system, to learn about the dangers of high sugar on the immune system, and exactly why diabetes and diabetic patients have an at-risk immune system. But better than all of that is that the effect that a low carbohydrate diet or a ketogenic diet has on your overall health and your immune function. So I hope that you will use this opportunity to do some of our courses, or just reach out to us and let us know how you're doing. If you have any questions, we would be very happy to answer them. We wish you love and strength and health in this very difficult time. Be well and stay safe.